Welcome to the deep dive. Today, we're doing something pretty fundamental. We are going to decode global mortality.
Right.
We're cutting through all the noise to look directly at the 2021 data. What actually killed us, what that tells us about global inequality, and what we really need to focus on next.
It's a sobering topic, but it is so essential. We've gone through sources that cover the entire global toll for that year. We're talking about 68 million deaths worldwide.
68 million.
And when you look at that scale, something immediately jumps out. It's the concentration.
The concentration is just staggering, isn't it?
It is. I mean, you group all those 68 million deaths together, and the top 10 causes alone,
Yeah.
they account for 39 million of them.
So that's what, over half?
That's 57%.
Yeah.
57% of all deaths on the planet from just 10 specific things.
So to put that in perspective for you, that means that if you manage to avoid just those 10 things, you have a better than even chance. But before we get into the rankings, let's get a baseline. How did the sources even organize all the ways a person can die?
Yeah, for clarity, it's usually sorted into three really big overarching buckets. First, you have communicable diseases.
So that's infectious stuff, parasites.
Exactly. That group also includes maternal, perinatal, and nutritional conditions. Then you have non-communicable diseases, the NCDs, those are the chronic ones, heart disease, cancer, diabetes,
And the last one?
and finally injuries. That covers everything from, road accidents to violence.
Got it. So our mission today is threefold. First, we need to understand the major global killers. Second, we have to trace the huge defining impact COVID-19 had. And maybe most critically, we're going to investigate this finding that what you die from is not random at all. It's highly dependent on where you live. All right, let's start with that big global picture for 2021. If you zoom all the way out, what's the unmistakable trend?
It's the chronic, long-term conditions. The non-communicable diseases, or NCDs, they are, without a doubt, the reigning champions of mortality.
How many of the top 10 are NCDs?
Seven of the top 10 leading causes of death in 2021 were NCDs. We're talking about conditions that people live with and often die from over decades, not days.
And what's holding that number one spot? The undisputed biggest killer.
That is still ischemic heart disease, or IHD. Basically, diseases that affect blood flow to the heart.
And the numbers are huge.
They are. IHD alone was responsible for 13% of the world's total deaths. That's 9.1 million lives lost in 2021.
What's really wild to me here is that it's not just number one, it's actually getting worse. The sources show it had the biggest increase in absolute deaths since the year 2000. It's up by 2.7 million.
Right. And that tells us two things. First, that globalized risk factors,
Yeah.
sedentary jobs, processed diets, they're winning.
And the second thing,
The world's population is aging, people are living longer with chronic conditions, so IHD just has more time to do its damage. It's a relentless threat.
but IHD had some serious competition in 2021, and that brings us to the COVID-19 effect. It wasn't just a new entry on the list. It seems like it completely changed the structure of mortality.
It was a true disruptor. COVID-19 came in as the second leading cause of death globally. 8.8 million lives lost in that year alone.
And that pushed everything else down.
It did. It pushed down these massive traditional killers. Stroke, which was always second or third, it dropped to third place. And chronic obstructive pulmonary disease, COPD, that dropped to fourth.
That's a huge positive. But while that's going down, other NCDs have been climbing the ranks with scary speed. What are the ones that are really growing?
Okay, we have to talk about two diseases here, and they both show the exact same rate of growth. It's quite remarkable. First, diabetes. Deaths from diabetes are up by 95% since 2000.
95%, almost double.
Almost double. And second, kidney diseases. They showed the exact same 95% increase, jumping from the 19th leading cause in 2000 all the way up to 9th in 2021.
So in just 2 decades, both of them have nearly doubled their global death toll. That points to some huge underlying systemic failure, right?
Precisely. Diabetes often leads to kidney failure. When you see those two trends moving in lockstep so quickly, it's a clear signal of a major global shift in metabolic health.
On a brighter note, there were some massive and very encouraging declines that are worth pointing out.
Yes. The progress against some communicable diseases has been phenomenal. It's a testament to global cooperation. You just have to look at HIV/AIDS.
What's the change there?
Deaths fell by 61%. It moved from the 7th leading cause in 2000 all the way down to 21st in 2021. It's completely out of the top 10 globally.
That's incredible.
And it's a similar story for diarrheal diseases. They dropped by 45%, moving from 6th to 13th. This is just proof that when we have sustained, targeted funding and intervention, it works.
Before we move on, I want to pull out one detail about Alzheimer's and other dementias, which ranked 7th globally. There's a burden there that doesn't fall evenly at all.
No, it really doesn't. It's a significant gender disparity.
Yeah.
Globally, women account for 68% of all deaths from Alzheimer's and dementias.
68%.
That one statistic tells you so much about the different impacts of aging and, frankly, the burdens of care around the world. So now that we have that global snapshot, we hit the really critical point, the income divide. The data shows the single best predictor of how you'll die is the economic status of the country you live in.
And this is where the deep dive gets so interesting, because those 4 economic groups, low, lower middle, upper middle, and high income, they paint 4 completely different pictures. Let's start at the beginning with low-income countries, or LICs.
Okay, so the mortality profile in LICs is almost a mirror image of the global average. People there are far, far more likely to die of a communicable disease.
How many of the top 10?
8. 8 of the top 10 causes of death in this group were infectious diseases. The fight there is still against these age-old killers.
So the top killer isn't heart disease or stroke like it is globally.
No. The top killer in low-income countries was lower respiratory infections. And diseases like malaria, tuberculosis, and HIV/AIDS, they're all still firmly in the top 10 there.
Even though we know HIV deaths have gone down.
Right. Deaths from HIV/AIDS decreased by 63% in this group,
Right.
which is amazing progress. But the burden is still so high that it remains a leading cause of death.
And there's a really striking contrast, right? A disease that's missing from their top 10.
Yes. COPD. It was 4th globally. It's in the top 10 for every other income group. But it does not appear in the top 10 for LICs.
Why is that?
That's a grim reason. Their populations often don't live long enough to accumulate that kind of chronic lung damage. Their lives are cut short by infection first.
And what about the pandemic? Where did COVID-19 land for this group?
It ranked 6th. That was its lowest ranking among all 4 groups. And that likely reflects a complex mix of things, younger populations, maybe less exposure early on, and tragically, probably significant underreporting because of weaker data systems.
Okay, let's move up the economic ladder to lower middle income countries, LMICs. This is where we see the transition happening.
Exactly. This group has the most balanced top 10 list. It's a
Yeah.
perfect split. 5 communicable and 5 non-communicable diseases. But the thing that really stands out here, COVID-19 was their #1 killer.
The number one.
It cost over 4 million lives in this group in 2021. They bore the heaviest absolute toll of the pandemic.
And what about that relentless rise of IHD we talked about? Where did that 1.4 million increase happen?
Right here. In the LMICs, they had the biggest rise in absolute deaths from ischemic heart disease. They are really entering that NCD phase at a rapid pace. We also see diabetes rising quickly here too, more than doubling since 2000. Their population caught between 2 worlds, the old disease burden and the new one.
Okay, now to upper middle income countries, or UMICs. We're talking about rapidly industrializing nations. Are they fully in the NCD epidemic by this point?
Much more so, yes. Their top 10 is heavily concentrated with NCDs. But what makes this group really unique is its specific cancer profile, which seems tied to that rapid development.
Tell us the specifics.
Okay, first, lung cancer. UIC saw a huge rise in lung cancer deaths, an increase of 442,000. Now get this, that is more than 2.5 times the increase seen in all 3 other income groups combined.
Wow. 2.5 times the rest of the world combined. That points directly at smoking and pollution.
It's a strong indicator, yes. And the second unique cancer here is stomach cancer. It features highly in their top 10, and they are the only income group where that's the case. It's often linked to changes in diet and environment that come with that kind of growth.
Finally, we get to high-income countries, HICs. This is where population aging starts to become the dominant factor driving all the numbers.
Exactly right. The total number of deaths in HICs is going up, mostly because their populations are older. IHD and stroke are still huge killers, combining for over 2.6 million deaths. But, and this is the critical point about HICs,
What is it?
they are the only group where deaths from IHD, stroke, and stomach cancer have actually gone down since 2000.
Wait, hold on. So IHD is declining in high-income countries while it's rising almost everywhere else.
Correct, by 15% in fact. It suggests that prevention, better health care, and public health campaigns are making a real difference even with an aging population.
But as those big killers recede, something else takes their place.
And it explodes. Alzheimer's and other dementias have increased nearly 4-fold since 2000. They're now the 4th leading cause and are on track to overtake stroke very soon.
And other diseases linked to just living longer.
They're rising too. Hypertensive heart disease has more than doubled. The mortality profile of a high-income country is a clear preview of an aging world. Less sudden death from heart attacks, more systemic failure from diseases of old age.
And what was COVID-19's impact here with all the vulnerable older
It
populations?
ranked second. It claimed 1.2 million lives, which really reflects that heavy burden the pandemic placed on nations where the median age is higher.
So we've sliced up 68 million deaths by disease and by wealth. We see this global shift to NCDs, but this huge, stark income divide is still there. For the person listening, why is it so vital for us, for you to know these specific, often grim numbers?
This is the most crucial question, really. Knowing what people die from isn't just about recording history. It directly impacts how people will live tomorrow. Mortality data is the feedback loop. It's how we know if our health systems are working.
And where we need to put the money.
And where to put the resources, exactly. If you see IHD deaths increasing by 2.7 million globally, that tells you your diet and lifestyle policies are failing on a massive scale.
So it's not just a report card for the health sector.
Not at all. It informs policies everywhere. Transportation, because we track traffic injuries. Food and agriculture, because we track diet-related diseases. Environmental regulation, because we track lung cancers from pollution.
The pandemic really put a spotlight on the countries that don't have good data, didn't it?
It absolutely stressed the need for robust civil registration and vital statistics systems, or CRVS. The shocking truth is that in most low-income countries, policymakers still don't know with any confidence how many people die or what they die of. The data collection is just too fragmented.
Which means they're essentially making policy blindfolded in the very places that need the sharpest interventions.
That's right. You can't fight what you can't measure. And that's why the WHO developed the International Classification of Diseases, the ICD-11. It's meant to be the global standard to help all countries generate timely, accurate data. The goal is to move past estimates and get to real, high-quality information.
This has been a heavy, but I think a deeply informative deep dive. The key takeaways for you are pretty definitive. The world is increasingly fighting a battle against non-communicable diseases, and COVID-19 completely rewrote the rulebook in 2021.
Right.
But most importantly, that stark contrast between a low-income country fighting infections and a high-income country fighting diseases of old age, that's the critical insight for global strategy.
It just underscores that global health strategy can't be one size fits all. It just can't.
Yeah.
We're seeing this incredible progress against ancient threats like HIV, but at the same time, we're grappling with this exponential rise of diseases linked to prosperity and longevity, like diabetes and dementia.
And to leave you with a final provocative thought, let's go back to those high-income countries and that profound trend. We said that Alzheimer's and other dementias have nearly quadrupled since 2000. They're on track to overtake stroke as a top 3 killer.
This surge is really shifting the definition of the mortality burden in wealthy nations toward conditions that require years, even decades, of intensive care.
Exactly. So what does this specific exponential trend tell you about the necessary immediate future of our societies? Think about the allocation of resources from elder care and staffing to medical research funding to the very structure of pensions and family support in aging populations. The economic and social implications of a world increasingly defined by these mortality burdens of advanced age. That is going to be a defining challenge for decades to come.
It's a powerful thought, and one that demands some serious consideration.
We'll see you next time on The Deep Dive.